I'm Dr. Geeta, professor working in SNS College of Pharmacy. I am going to present a case related with diabetes mellitus. So, diabetes mellitus is an alarming disease, and in type 2 diabetes mellitus, it is treated with oral drugs. So, the most prescribed oral drugs are vitagliptin, metformin, enagliptin, etc. So, a 55-year-old female was admitted in the Karpagam hospital and she had a complaint of oliguria. So the diabetes mellitus patients has to be carefully monitored for these type of renal disorders too. So she had a difficulty in urination, and she has been found with the symptoms nausea and burning micturition. And for the past history, she had type 2 diabetes mellitus, and she had been analyzed for the routine biological parameters, and she had a lower level of hemoglobin and a higher amount of lymphocytes were found, and her eosinophil rate was also higher, and the red blood cell count is also more, and blood urea also increased in this case. So the treatment protocol was given here, that is, she had been injected with the dextrose normal saline and ingal lactate. The antibiotic was a fluoroquinolone, ciprofloxacin, and anti-emetic and antiemetic domperidone, ranitidine and metformin, enalapril and paracetamol. So this is the drugs injected for this, and so the treatment protocol has been given here. And what are the reasons for this admission in hospital is all this, as already discussed. She had oliguria and all other symptoms for the past 4 days, and the laboratory investigation has shown a lower level of hemoglobin and other parameters as displayed here. So the tests were done for various biological functioning system, and it was found to be, the diagnostic report has been, she had been suffering from urinary tract infection, and also she had type 2 diabetes mellitus. So the causes for this present condition may be due to E. coli or bacterial infection has been confirmed by the urine analysis. So after treatment, the patient was found to be normal and she got rid of all this symptomatics. So the discharge medication, we had metformin, enalapril at a dose of 2.5 milligram 2 times daily, and also paracetamol is also a dual dose morning and night for 7 days. So these are the pharmacist intervention. The pharmacist intervention is when enalapril and metformin are given together, there will be a high risk of hypoglycemic condition and also acidosis. So we have to monitor when the dose is administered. Similarly, with ranitidine and metformin, the metformin can be replaced with insulin for a particular time. And with the fluoroquinolones and metformin, the fluoroquinolone ciprofloxacin can be replaced with norfloxacin So in order to get rid of the side effect. And there may be an interaction with metronidazole and paracetamol. So the paracetamol can be replaced with other NSAIDs like mefenamic acid derivatives, aceclofenac. So the drug alcohol interactions may be minor. So if the alcohol is administered, it will decrease the effect of acetaminophen since it affects the hepatic enzyme. And also metronidazole will increase the hepatic enzyme metabolism. So we need to, what are the minor thing is alcohol, drug alcohol interaction we have seen, which will reduce the effect, hence alcohol has to be avoided. So the general goals of the treatment is to prevent the systemic consequences of the infection and to eradicate the invading organism, to prevent any adverse effects of the therapies, and also to improve the quality of life. So the parameter will be glucose level will be monitored regularly, so in order to avoid the complications. So the physician has to go take into consideration all these hypoglycemic levels and also the interactions with the metformin. So about the points, the patient has to be well educated with the disease and drug interactions and lifestyle changes, and about the diet and exercise. Counseling has to be given, and it has been given during the discharge. So this is the case history and the recovery status of the patient while discharging. Thank you for listening. Thank you.